really wanted to be a nurse when I was younger. I was actually the person that actually ran away from the nurses when they were about to give shots. And then, believe it or not, I ended up getting into school for phlebotomy and became a phlebotomist. I graduated in about 2010. I worked in pain clinics doing toxicology. We did a lot of PRP, so I did a lot of the toxicology reports there, and I also worked with them on the other side of the clinic doing all the large blood draws for the regenerative medicine. Worked there for about 8 years. I was actually a patient at Pearson and Wary, and I just really liked the environment when I came. And I would always joke around with Dr. Weary. He was actually my provider at the time. Would always joke around, pretty much saying, "No, I'd want to work for you one day." And we would just joke around, and I don't think he actually took me seriously. I ended up applying. I started off at the front desk just to get admin experience, and then with all of my background, they got their decompression and laser equipment, which we did. I did a little bit of laser at my old job at Northwest Spine and Pain, but it was a little bit of a different laser. We did infrared laser there. So I kind of just volunteered myself. I was just like, hey, I was just like, I do have experience in laser. So if you need, you know, anybody with experience, I'm your girl. So that's kind of how I got into the position I am in currently. My name is Kayla Jackson. I am the medical assistant here at Pearson and Wary Chiropractic. I currently hold a medical assistant phlebotomy license. So what I do here is I do both our laser treatments and decompression treatments. So our laser treatments, I can treat anything from shoulder pain, back pain. I treat a lot of post-op patients that have had like orthopedic surgeries. Once in a while, dental procedures. We can treat anywhere from pain to inflammation to wounds to gut health. We also provide something here what's called our brain club. So we kind of just focus on the brain, people that pretty much know of a history of family members that have had either like dementia or Alzheimer's. Pretty much patients that kind of have cognitive issues or want to be proactive and avoiding that, knowing their family history. So I am the one that actually does the laser treatments with our patients. And our decompression table, we can treat either cervical or lumbar. Patients that come in with back pain or neck pain, it is a little bit different than an inversion table. A lot of my patients ask what the difference is. Our specific decompression table is a computerized decompression table. We're able to remote on how much weight we are pulling the patient. And a lot of patients that have had back pain, cervical pain, have definitely gotten relief from a series of decompression treatments that we've done here at the office. I have one current patient. She came to see me for laser treatment for neuropathy. With actually after her first session. I mean, so typically it usually takes about 3 to 4 sessions before patients start noticing a big difference in their pain level. She noticed a big difference after one. She said after leaving here, her pain was almost completely gone. And not only is she coming now, she's actually, I'm actually treating her husband as well for a different issue, but she has really spread the word on how the laser has worked for her. She's able to walk better. I currently have another patient who has had a total knee replacement and had really a hard time recovering after a knee replacement. And after like 3 or 4 sessions, she's pretty much said the pain has been completely gone. And as of now, she just comes in as needed. If she even feels like a little bit of pain, she'll come in. She's referred tons of patients for laser treatment here. My name is Kayla. I am the medical assistant here at Pearson Wary Chiropractic. I encourage you to come and see us if you are struggling with either neck issues, back pain, shoulder issues, or knee issues. Pearson and Wary is the place to be, and we hope to help better you in your journey to feeling better.